Today, we have a very full-packed agenda with 6 speakers, which will give us their insights on the topic. But before it, I would like to remind you some housekeeping rules. First of all, please disable the microphones upon entry to minimize background noises. Use the chat to write the questions during the presentations. You can, of course, put your camera on if you have a stable connection and if you are willing to do so. And in the question and answer moments, which will be developed after each presentation, kindly raise your hand and we can allow you to unmute for questions. Finally, please do note that this meeting will be recorded and made available on the Resilience website. So concerning the agenda, following a welcome and introduction by Nadesh and I, Prasanta Kumar Roy from HWWI will present the empirical evidence on the influence of the heat waves on non-communicable diseases. Fred Hatterman from Transformar will then discuss the impact of climate change on heat, health, and outdoor productivity in Europe. Carmen Torres Costa from EURECAT will present a model to assess microbiological risks in the coastal bathing waters of Barcelona and their different heat scenarios. Teresa Kaiser from Adelphi will then share examples from regions and cities in Germany on reducing the health effects of heat, while Dimitris Kofinas from RCNOE will share the project's approach on addressing extreme heat waves in Athens. Finally, we will have a presentation from the Health World Organization by Marisol Iglesias Gonzalez on preventing heat effects from heat in the European region. And we will finalize this session with a wrap-up and closing, which will also include a satisfaction survey, which is very important for us as input for the upcoming open training sessions. Now I will give the floor to Nadesh, who will give us more information about this program and the Resilience project. Nadesh.
Thank you very much, Leslie, and thank you for the nice introduction. Indeed, as Leslie just said, my role today will just be to introduce the context a bit of this training session. And introduce a bit the Resilience project in 1 or 2 sentences. So the Resilience project objective is to help regions develop a pathway to resilience. We are focusing mainly on 7 regions, but we also have activities open to all. So these webinars are the activities that we are creating for everyone, for practitioners, for local and regional authorities, for any kind of even a citizen a citizen organization and civil society organization. Sorry, so everyone can join here. We had 2 cycles. We have 2 cycles. The first one is now closed, and it focuses. The first cycle focuses on cross-cutting topics and cross-sectoral topics, mainly introductory also aspects to the pathway development. So we had 1 session on the EU landscape, all the initiatives currently ongoing on climate adaptation at the EU level. We also had 1 session on pathway development, another one on funding, and a 4th one on governance. And the objective was to raise awareness and to give tools also to start in developing pathways. Now we are in the 2nd cycle. We already had 1 session on energy and adaptation and mitigation and adaptation. And this cycle will focus more on sectoral challenges, available solutions, and good practices from regions and for regions. Here, the objective will be to provide know-how and inspire all of you to implement the solutions and to start with developing the solutions and implement them. If we go to the next slide, I will just it's just a reminder that we have the recordings of all the past webinars, so you can go to Resilience website I will also put the link in the chat so you can access it. We have a YouTube channel, and you can see all the recordings from the past sessions. So do not worry if you missed one of the session and you're thinking that, oh, but this topic is really interesting. You can still access it. And without further ado, also because the agenda is quite packed for today, we'll directly dive into the welcome survey. So this survey is just a very short survey for us to get to know a bit more about who is in the room and the participants. It's also a way for the speakers to know who they are talking to, and if they want to highlight one aspect of the presentation based on this is the way they can do it. So how do you do to complete the survey? You have two ways. Either you scan the QR code that you see on the screen, quite big QR code, so quite easy to spot. Or you can also directly go to the slido.com website and use the code that you see just below 175845.7 to enter the survey. I see that already we have participants responding. Maybe Leslie, if you can go to the next one, we can see the first answers to the survey. Okay, thank you. So as we can see, people are coming from Germany and Belgium and Spain, of course, but Germany is bigger, so I guess more people from Germany. Okay, people from Greece. Okay, so we now have 11 and 5 responding. I think we can go to the next question. We know people are coming from Germany and Belgium in majority. And which type of organization do you work? For which type of organization do you work? So we can see that half of the participants that are responding, of course, not everyone is responding, come from NGO and non-profit organization. Then a lot of people also from academia or research organizations, and also local and regional authorities, and others. I'm always curious about knowing who are the others, because we try to have a nice overview of all the kinds of organizations. But yeah, I'll think of new ones for the next time. So you don't have to click on others, but you can click on the one. So majority of NGOs, associations, and research organizations. Thank you. So I think we can go to I'm not sure we have another question. Yeah, we can directly go to the presentations, also looking at the time. Thank you very much, Leslie.
Perfect.
I give the floor back to you.
Perfect. Thank you so much, Nadesh. So without further ado, we will start our presentations with the first one of Prasanta Kumar Roy. Prasanta, he's a research associate at the Helmut Schmidt University, the Leibniz University, and also an associate member of the research department, Environmental and Climate Economics at HWWI in Hamburg, Germany. He's currently also a PhD candidate in empirical economics, and in his research, he primarily uses the methods of modern econometrics in the field of energy and climate economics. Prasanta, the floor is yours. I will stop sharing so you can share your screen.
Do you see my screen?
Yes, you just have to put it in full mode.
Yeah. Now?
Yes, perfect. Thank you.
Okay. Thank you very much for the nice introduction. So this topic is on effect of heat waves, specifically on NCDs or non-communicable diseases. And this we have done on as part of a project known as Mount Adapt, which is supported by European Commission. For this, we have already published a paper on literature review. In this, we have collected around 3,000 odd papers from various databases like Web of Science, PubMed, Scopus, and we used a string pattern to search for papers which focus or work around topics like effect of climate change, effect of weather, effect of heat waves, effect of floods on various types of non-communicable diseases. For example, diabetes, heart and circulatory problems, breathing problems, and other problems like blood pressure, etc. And we filtered out many papers out of these which were most relevant for our study, and we found around 150 odd papers which were most relevant for us, and out of those we filtered out we found heat waves and associated events which affected non-communicable diseases for related to morbidity and mortality, and around 40 papers we found which focused on these topics. So on the left hand side of the slide you could see a snapshot of the paper. If you want, feel free to access it online for more details. So overall, from our paper, we find that year on year, more studies are coming into the databases. So this implies it's a very hot topic and more research is being done. Also, we found out of all the extreme weather events, for example, floods, hurricanes, heat waves. Heat waves are the most studied extreme weather events in terms of non-communicable diseases. We also found a quite heterogeneous or wide variety of definitions of heat waves in the literature. For example, some papers focused on percentile-based definitions, which defined certain thresholds relative to historical means or historical median distributions of temperature. And based on that, these papers have set certain definitions of heat waves. Some other papers focused on absolute temperature definitions. For example, if the temperature is greater than 30 degrees Celsius or 37 degrees Celsius or 40 degrees Celsius, based on the region's mean temperature in a particular season, for example, especially during the summer season. There were also other temperature definitions, for example, heat indexes, which also included the physical feel of the temperature by considering factors like relative humidity, precipitation, altitude, and other factors which actually influence the non-communicable diseases or have a direct impact on the non-communicable diseases. There were other definitions, but we won't go much into the detail of the definitions. We would keep it open for the discussions later on if anybody has questions. So moving on, we also found that most of the studies focused on developing countries and regions which are in general hot, like in Africa, in some parts of Asian countries also. For example, in India, in Bangladesh, and also in other regions like Australia, which are in principle hot and arid across the year. We also found that most of the studies are very specific to local regions, not at a country level or at a global level. Most of the studies are focused on a very local region of a particular country. As because our project focused on mountain regions, especially for Europe, we also found that there are very few studies which are focused on pan-Europe as a whole, except for a few country-level studies in Spain or France or Switzerland. We also found that there are very few studies done in colder regions or mountain regions where climate change is found to have witnessed more increase in mean temperatures in due course of years. So for example, in hotter regions, it's more evident, but in colder regions, the increase in temperatures are not that studied as is required. We also found significant increase in morbidity with respect to respiratory and cardiovascular diseases. However, for mental health, which is also a very big topic nowadays, we found inconclusive results in terms of statistical significance or direction of estimates from statistical models. For example, in some studies, they show signs, quite opposite signs. That means if temperature increases or if precipitation increases, it should lead to higher mental health problems. However, in many studies, they find either statistically insignificant results or they find it causing less mental health problems, which was not in line with the hypothesis. We also found that most of the studies have not been able to address the confoundedness between extreme weather events and non-communicable diseases. This is a very simplistic example which I have put here for explaining. For example, during heat waves, there are some wildfires in certain regions, which leads to smoke from the wildfires, which also causes respiratory problems. However, due to heat, there are also droughts, which causes increase in particulate matter emissions, which also causes respiratory problems. So these kind of confoundedness between different types of extreme weather events and between non-communicable diseases have not been disentangled in the empirical literature. So this is a snapshot of one of our results in the paper, where we find that heat waves leads to significant increase in all-cause mortality. So these are some selected papers as references. For example, Foulet in 2006, they focus on heat waves in France during the periods of 2000 to 2003, where they find around 15,000 deaths, which is higher than the threshold of as compared to 2000 year. Another paper in 2015 by Shen and their co-authors find heat waves in Nanjiang in China during 2007 to 2013 has an increase in total mortality of around 25%. So this is with respect to all-cause mortality. That means the NCDs are not separated. However, the papers also focus on individual specific cases where cardiovascular mortality is being studied in Foulet paper, and they find around 3,000 odd cases of excess deaths as compared to the previous year heat waves, and especially because of circulatory system diseases. So in spite of the fact that they focus on cardiovascular mortality, they try to narrow down from all cause to very specific cases of NCDs. Still, the cause of deaths are not disentangled in the sense what are the specific types of circulatory diseases. Are they very specific to, let's say, PTCSD or circulatory blockage due to heat waves caused by wildfires and so on. The other paper by Shen in 2015 in China, they also focused on cardiovascular mortality, and they found around 50% higher cases as compared to previous years of heat waves. So moving on to the mortality cases, both of the papers on which we have focused, they have tried to focus on also cerebrovascular mortality, neoplasm. So these are mortality related to circulatory diseases, and some are also related to respiratory diseases, but not specifically defined. Now moving on to morbidity. In case of morbidity, we find a very nice paper by Turner Cornell in 2013, where they find that heat wave and direct temperature have caused significant ambulance or hospital attendees in Australia, Brisbane during the period of 2000 to 2007. The difference between the temperature effect and heat wave effect is that temperature effect measures the effect of direct temperature variables on hospital attendees. However, the heat wave effects measures the effects like for consecutive two days or 5 days or 9 days. If the temperature is greater than 37 degrees Celsius, then that day is considered as a heat day. Okay, so similarly, these are the results for morbidity in terms of cardiovascular and respiratory. So overall, we find that there are papers which have found results which are significant. However, the results vary. There are not systematic, statistically significant results. And there are inconclusive results for mental health issues from all these papers. So based on our findings, we would recommend to estimate comparison based on the definitions by giving specific considerations on the definitions, which we could not based on the scope of the paper. So to be specific, we did a qualitative analysis and not a quantitative meta-analysis of the estimates, which could be done in future research. More focus on the developed regions of Europe is required, which we found are missing from the papers which we gathered. More focus on mountainous and colder regions is necessary, as we already have lots of evidence on hotter regions and dry and arid regions. Also, very granular or minute level health data on pan-European level is required to match with climate data sets for a better research design per se. For example, the health data which is available, they are either at a very macro level, either at NUTS 2 or NUTS 1 level, where there is not much variation across regions in temperature, across days or in weeks, which causes difficulty in developing a research design for causal interpretation. And we believe that based on these recommendations, it might be helpful to disentangle the effects between different types of extreme weather events and non-communicable diseases. And finally, based on the estimates from these papers, if health forecasts based on the changing demographics or socio-demographic variables could be done, then this might be helpful for policy recommendations for either to hospitals or insurance companies, as well as to build resilience-based measures in the healthcare systems. Thank you. So this was my time, and the floor is open for questions.
Thank you so much, Prasanta. Very interesting presentation. As Nadesh said in the chat, please do not hesitate to write your questions on the presentation, or of course you can also raise your hand and we will give you the floor. So far, I don't see any raised hand or questions, but I do have a question. So thank you again, Prasanta. So it is clear that there's a direct link between heat and, as you said, the increase of mortality. But of course, this also is related to the time of to the heat exposure. So I would like to know a bit more in detail if based on the collection of all the data, if there has been more information on how much time it is needed for the people to be exposed to the heat in order to consider an increase on the mortality rate.
Yeah, so there are various papers which have tried to focus on various thresholds of temperature and various time periods. For example, this Turner, Connell, and the paper which do you see my screen of presentation till now?
Yeah, we still see it. Yes, yes.
So I will quickly go to the paper. Yeah, so this paper by Turnell, Connell, and Tong in 2013, which is being done in Brisbane in Australia during 2007. So they try to explore different time periods. For example, a consecutive higher temperature of 37 degrees Celsius for 2 days, for consecutive 3 days, and like that up till 9 days. And they find statistically significant results when the temperature is higher than 37 degrees Celsius for consecutively 2 or more days. So this is one type of evidence. There are other papers which have found more than when for more than 9 days the temperature is higher than 98 percentile with respect to the historical temperature of that region, then they find a significant effect on mortality in terms of heat waves.
Thank you again, Presenta.
Yeah. Does this answer your question?
Yes, yes, you did. Thank you. Thank you so much. So without further ado, we will continue the presentations. I will present our next speaker. I don't know if you see my screen. I hope you see my screen.
Yes, yes.
Perfect. So our next presentation will be presented by Fred Hatterman. Fred Hatterman is the Deputy Head of the Department Climate Resilience at the Potsdam Institute for Climate Impact Research and leader of the PIK Group on Hydroclimatic Risks. Fred has more than 25 years of experience working in climate impact and adaptation projects in Europe and worldwide. Thank you so much, Fred, to be here with us today. The floor is yours.
Thanks a lot. I will share my screen. I think you see it.
We do. Thank you.
Okay, then I start. Yes, thanks for the nice words. I immediately step into my presentation. So I'm working in the Transform R project, which is a sister project of Resilience, and some other ones are Zeno, for example, working mainly in Europe. And here are the demonstrators we have, the case studies, the regions. From Spain, we have also West County in England, we have La Paranta in Finland, but we have also the southern ones. Egalos is a part of Athens, and Oristano, this is in Sardinia, and this is Guadeloupe, which is still part of France. And as you see, there are some in the really hotter regions of Europe, and heat is a concern. This is why we had a look at how heat may, or climate and temperature may develop under climate change conditions. And what you see here is for Egalos, this is one in Athens, how the mean daily temperature may develop. And what you see here are the different scenarios. And you see a steep increase in mean temperature. And it is often so that the extremes even increase faster and stronger than the mean. And we also had a look at how the seasonal changes may be in the near future. here in the temperature change. Here are the months in the year. So you have the seasonal changes, and what you see, especially up until end of the century, under certain conditions, there may be strong and partly very strong increases in mean temperature, and the more so also in extreme temperatures. And having a look at the statistics, and here again for Egalo in Greece, where you see, and we talked about this, that consecutive days are very important, and here we have a look at extreme values, days with maximum temperature above 30 degrees, and 6 in a row, and you see how many more days we may have under specific climate change conditions. With this, we summarize a bit here. We have hotter summers in the Mediterranean, milder winters, and overall less rain. And this will also add, possibly, as discussed before, to the problem, because it might be that we have more droughts, and therefore also the air quality may decrease, and the combination of heat and air quality is in the end also a huge problem. Now, looking at indicators, and we came across the wet bulb globe temperature, and it is the result of some projects we had in Germany with the hospitals, with the medical sector, but also in worldwide now in Africa, for example, where the question is whether specific areas are habitable for humans under climate change conditions at all. And just to explain what it is, there are, of course, different factors impacting on the heat load exposure, heat exposure of humans. And important is, of course, air temperature and sunlight because of the skin temperature. There's humidity, which affects heating and cooling. Then there's wind speed, because wind takes away the hot air around our bodies and helps us to transpirate. And these factors are all part of the equation for the wet bulb globe temperature. So it is an apparent temperature. Now, looking at the limits, at the thresholds, for example, it starts getting a problem when we have this apparent temperature of over 25 degrees, and the higher it gets, the stronger is the impact, and the more people have to rest. But it's of course also affecting vulnerable people. It affects mortality not only, but also morbidity. So people really suffer under these conditions, and it might be that we get conditions where we should not work in outdoors at all. And this is my next point. There's also a connection of the wet bulb globe temperature to outdoor productivity, and this is shown here, where you see the y-axis, the percentage of full working capacity. 100% would say no problems with the heat conditions, heat loads, exposure under these outdoor conditions. And here you see the wet bulb globe temperature. And of course, it might be that you do hard work outside or light work, and this is shown here with different values. And what is really important is that above 25%, at 25 degrees mostly, that the work you do outdoors within an increase of only 2 degrees may be cut by, or may decrease by half, by only 2 degrees more in this range here. Much less work capacity outdoors, and this is of course also a strong effect we may have in southern countries. Now, looking at again example from South Europe, it is again around Athens, and what you see is here now how the wet bulb globe temperature may increase under climate change conditions up until end of the century. And it is a hot scenario, but it is a scenario we are following now with our emissions. And you see a steep increase, and you see also that already now, wait a moment, already now we may have a problem under certain conditions, but this problem will really increase. And this will also then lead to much less outdoor productivity. we have here the scale on the y-axis, and it decreases down to an extreme conditions, 45% only of the outdoor working capacity, looking, for example, of work farmers do or construction workers do heavy work doing outside. Yeah. And it links, of course, also the results I show here to the last presentation, where Dimitri will then have a look at heat waves, extreme heat waves in Athens. Now, we condensed all the results for entire Europe in a portal. It is and it is done so that everybody can have a look. And I will show you briefly through it. So this is a portal. You can then step and look at different sectors. Here is a link, and if I step onto the link, I hope you still see it. I open the portal. Let's firstly have a look at climate. I briefly show you through what it does. We have different languages, 4 languages. I will now show, for example, how maximum air temperature may change under climate change conditions. I have a look at the hot scenario. The scenario we are following now with our emissions, and I look at summers, because in summers, of course, we have most of the impacts of heat. Yeah? And now you will see how the maximum temperature may increase under climate change conditions. Now this is temperature. Now looking at health, and here at the web bulb globe temperature I explained before. We look at the max web bulb temperature over the day. Again, we look at the settings. We have now the hot scenario, and we would like to have a look into the summer. Yeah, and also here you will then see how it develops under climate change conditions, how it gets worse. And you can also zoom into. For zooming, you should use this plus and minus. And now I look into another area. Let's have a look at Decilia, for example. And here you see how the web bulb globe temperature may increase under these conditions in future. And you would also get some data which you can then export. And we have chosen as a spatial resolution the NUTS2 regions, which most people, I think, are familiar of. Yeah. Okay, and now this was the health and heat and indicator web bulb globe temperature. Let's have a look at outdoor productivity, how this may change under climate change conditions. I look at heavy work now, and I look again at the settings. And I look at summer. It is again the hot scenario. We can again zoom into results. And let's now have a look at Decilia again. There you see again the steep decrease of outdoor working capacity under climate change conditions. And this is, of course, a heavy impact for like farmers and outdoor workers. Okay, if you are interested, you also get some information about the indicators we have, how they are defined, and all that, so that you have a knowledge base. With this, I post now the internet presentation and come to my next slide. So as a summary, climate change will significantly increase the heat load. I mean, this goes without saying. And this is, of course, mostly a problem also for vulnerable people. Vulnerable because they are ill, vulnerable possibly also because they have to work outside. Yeah, and it is especially a problem when also what air quality decreases, or there's a problem with air quality. And also the outdoor productivity may have an impact under these hot house conditions we may have in future. Yeah, with this I would like to thank you. And this is my last slide. Thanks a lot.
Thank you so much, Fred. Very interesting presentation. Also a tool very useful, I'm sure, for many stakeholders at the regional and local level. I don't know if, once again, please do not hesitate to put your questions in the chat or raise your hand. Presenta, I think you have a question.
Yeah, So my question is to Fred regarding the data. I can have a look at it later, but just for now, how you said it's at NUTS2 level, and what is the temporal level from which it is available earlier?
Now we have it in, if I'm right, in 10 years steps, but the underlying data are daily. So you could easily get the 10 or the decadal data, but if you would like to have additional data, simply drop a message and we will handle it. Yeah, because to download all the data, it is simply too much. So we have then to select and streamline the output to your demand. But the underlying data are even sub-daily actually, because we of course have to calculate the indicators for the hot period of the day, and this is then sub-daily.
And what is the temporal frequency available? Is it at annual or monthly or daily?
It is sub-daily even. It is daily. The original data are daily, but we did the downscaling to sub-daily. But you can also have them like monthly or what you like.
Okay. Thank you. That was it.
Thank you for your question, Presenta. Alison?
Yes, good morning. Thank you very much. It was very interesting. I'm also, given I think Europe has only about 20% of air conditioning rates in houses, and I'm wondering whether we're also, you have any information or looking to do any information on indoor productivity during extreme heat, given that's also going to become an increasing issue.
Yeah.
Thank you very much.
Thanks a lot for the question. Yeah, this of course has also an effect, and there's of course a link, and we are now in a project where we try to really establish a link that we have equation in the end, so which you can easily then apply, and we have measurements indoor and outdoor, and with this we would like then to establish this data source or this equation, which you then can apply to the outdoor climate data. Thanks.
Thank you so much, Alison, for your question. Something to remind is that just in case, all the presentations will be shared with the participants after this session. So if you want more information, I'm sure you will find it under Fred's presentation. And also, I encourage you to check the link that he shared. It's very interesting and I'm sure very useful for many stakeholders here today that are joining us. We will continue because we have.
Sorry, there's a quick, just a question in the chat, if I may quickly answer it. Whether the wet bulb group temperature is also suitable for vulnerable people, and I think yes, because it is widely applied in the medical sector, and you should have a look at the literature around it, and I'm sure you find something. Yeah, this I think was the last one.
Thank you so much. Thank you so much, Fred. We will continue with the next presentation from Carmen Torres.
Yeah, I'm here. Yes, I was sharing already, so I will try to share again.
I would like first to present you. Just give me some moments, please.
Okay.
Yes. Thank you so much, Carmen, for being here. Carmen is a chemical engineer from the University of Santiago de Compostela, where she worked as a researcher in the environmental modeling group of the Department of Chemical Engineering until 2010. Since 2021, she has been a senior researcher at the EURECAT Foundation, and since 2016, she has also been an associate professor in the Department of Chemical Engineering at Rovira I Virgili University. I hope I said that correct. Thank you so much, Carmen. Again, the floor is yours.
Thank you. Good morning, everyone. And thank you, Leslie, for the nice presentation and for giving me also the opportunity to participate in this open training session. The title of the presentation is there, so it's waterborne pathogens, outbreaks, and extreme weather events. The idea behind this title, this quite long title because it's another one there, is somehow discussing how climate change, particularly extreme weather events forced by global warming patterns can impact the risk in human health in coastal areas, in bathing, so in beaches and people, swimmers that are in these areas, right? So, well, this is an overview of what I will cover in the next 15 minutes. I will start just with a little introduction to the Impetus project, and its objectives is the project under which we are developing this case study, this tool, this solution. And then I will move to explain a little bit the problem, so the description of what is a CSO and the relation with the climate change. And then I will explain also the model very briefly, the tool, the solution we proposed, and its application and some preliminary results, because we are still working on it. And finally, I will provide an outline of the future work that for sure we will need to do. So Impetus is a sister project of Resilience, is an European project. The title is Dynamic Information Management Approach for the Implementation of Climate Resilience Adaptation Packages in European Regions. And well, you can see in the slide some numbers, general numbers there. And well, seeing this long title also, you will say, okay, but what does it mean, right? And so, well, Impetus aims at developing specific climate adaptation solutions addressed to 7 demonstration sites across different regions in Europe. They call it biographical regions that have some features in common related to the challenge that we must face due to climate change. Well, in these regions, the project develops at different levels tools to tackle the specific challenges. And well, the general approach emphasizes collaboration with local communities. One key aspect is improving data-driven decision making. So it's boosted by these advanced digital tools, modeling, real-time data, artificial intelligence, those kind of things. And the solutions focus on co-creating with local communities and focus on vulnerable sectors. Well, from the technological point of view, the idea is to being able to upscale existing local or territorial data and innovations with the potential of being applicable to other sites, right? Well, of course, knowledge dissemination is an important aspect, and developed solutions are expected to account with this high visualization as my previous platforms, as we have seen in the previous presentation, something so that engage the audience, let's say. And well, regarding the specific, let's say more in detail, specific problem to be tackled, the framework is a Mediterranean coastal biogeographical region with the specific climate change adaptation challenge of improving bathing water quality after extreme storm events. So let's say that the physical domain, if you want to say, proposed is bathing waters near a combined sewer overflow in a urban beach or the city of Barcelona. This is the case study, the specific domain to validate or to prove the tool, okay, this solution. So, Barcelona is a high populated city in Europe and has a Mediterranean climate characterized by intense rainfall events, right? And so one major issue is the existence of this combined sewer system. What does this combined sewer system imply? That CSO, so combined sewer overflows events, may occur. And what are these CSO events? So, and their implications, let's say. So they occur when stormwater overwhelms the sewer system, so causing this it's producing that untreated sewage is released into natural water bodies. So with climate change, stronger and more frequent storms will increase the frequency and intensity of these CSOs, these combined sewer overflows, increasing then the pollutant releases, increasing contamination, so pathogens like E. coli, norovirus, adenovirus, along with chemicals, microplastics that pose health risk for the population are more, let's say, in the exposure of the people, right? And so apart from that, there are also significant economic and social impacts, such as beach closures, increase of healthcare costs due to possible outbreaks. What is the relationship between climate change, heat waves, and CSO occurrence? Well, you can see in these slides, I'm not an expert on this, but it's well documented by different very well-known and trustful institutions that as temperature rises, so the atmosphere can hold more moisture, so leading to a heavier rainfall. So studies indicate, for example, that a 12% increase in extreme rainfall events it was documented in the last decades. So this also the climate models predict that this trend will continue and intensifying let's say the weather cycle, and then increasing the CSO frequency and intensity. Okay, so how this this problem is being managed by the authorities all over the world. So in general, you can see here some strategies followed. They are taking actions mainly through infrastructure upgrades and plans for better maintenance, nature-based solutions. And well, one of these, and that is common in all the cases, is to monitoring, so real-time monitoring, right? And is in this strategy for early warning systems, where the tool, this solution that I will show you, let's say that can have like an interesting role. And well, for the specific case of the city of Barcelona, there is an institution, a water cycle control center, is the meaning of this casa, that manages the sewage, the drainage, the beach conditions, and is integrating all the data and information to optimize the response in the case of heavy rains and the possible affectation to the population. So, for instance, in the domain used to validate this tool, to prove, to test, the concept, to prove the concept of this solution, you can see in the picture that there is a breakwater there with an inner channel, and in this inner channel is where the release of the CSO in this case is produced. Okay, and so for example, Becasa monitors weather and buffer conditions in the tanks in order to send pre-alerts or or alert warnings due to this wastewater discharge. And in these cases, during summer seasons where the people is there in the beach, the water quality is also monitored through sampling and real-time analysis of different microorganism indicators. So in points of the bathing areas near the CSO point. So based on this information, the authorities launch like a preventing information, or maybe they close the beach in certain areas for some periods. So given these scenarios, what are the objectives of the tool presented, of this tool that we are developing? This QMRA model in the project impetus. Well, the goal is of this quantitative microbiological risk assessment model is to predict the level of risk to swimmers' health due to the presence of pathogens in the bathing areas. Okay, so in the event of a CSO. At the right part of the slide, you can see an outline of the workflow that is used or that was used in the previous tool developed in a previous project. So the idea is from the online monitoring of indicators of pathogens, we can estimate the concentration of pathogens, and then based on this, the potential exposure is estimated, and then the level of risk of infection is calculated. So this workflow or initial model was upgraded or improved in two main lines or ways. The first improvement was to improve the calibration between the ratios of indicators, of fecal indicators to pathogen ratios. So we did some new sampling campaigns during the CSO events in the last year. And the second was the developing of a transport and decay model that was with the objective of predict the evolution of the concentration of pathogen through time and also in the space near the CSO point. So it's like predicting the movement of pathogens, let's say. In this slide, you can see in red in the flow diagram the items that are like the improvements. Okay, we incorporate this improved pathogen to indicator ratios and mainly the transport model that accounts for the degradation or deactivation of the pathogen using environmental data. So then the workflow includes running this two-dimension transport model to simulate the pathogen movement. So this allows us to generate heat maps to assess the infection risk based on exposure and those response analysis. These are some preliminary results now. We have tried to replicate past CSO events, trying to validate the model using data from this institution, Becasa, in terms of duration and flow rate of the discharge during the CSO, and an initial concentration of pathogens in the point of the discharge is with this monitoring that with the sample campaigns, in fact. Also, then the transport model is fed with weather data and marine conditions. And so the one thing that we can obtain is what you can see at the bottom in the left part of the slide. That is the evolution, the pathogen concentration evolution along the breakwater channel that can help us to understand the contamination, so how the contamination is spread. And then also at the right side, the concentration map in the area around the breakwater. well, then we have also have made a seasonal study assuming an average CSO intensity and seasonal average marine and weather conditions. So under these different scenarios, we produce or reproduce the risk of infection for a norovirus and adenovirus. These are some of the results. And as you can see, during summer and winter, the risk is higher, assuming that the exposure is the same, which is not the same because in summer the exposure is higher. So much during, so the contamination or the risk, the level is higher during much time during these seasons, mainly because the water current patterns. We are basing this on average marine conditions. These seasonal studies need further refinement, taking into account also patterns in CSO intensity. But for you to know, for example, in summer, the intensity of these storm weather events are more frequent. More future work to be accomplished, but probably another funding opportunities probably is to include the integration of machine learning the strategies to predict the CSO intensity and duration. So using this historical data of rainfall and sewer data conditions, we can incorporate the forecasting of risk levels. Okay. So this will be the idea of the final objective, let's say. With this capacity, we can this can allow us to make also simulations of climate scenarios, so making projections and trends of risk of infection given the climate scenario projected by climate services. So, in summary, extreme weather events will increasingly impact coastal water quality. And this tool, let's say, our QMRI model represents one step, let's say, in the direction of predicting waterborne infection risk in bathing waters due to the presence of CSO points. And so future efforts will be in the line of enhancing the forecasting capabilities of this tool. This is over from my part. Thank you very much for your attention, and I will be happy to take any questions.
Thank you so much, Carmen. Yes, so we have a question from Nadesh.
Yes, thank you very much, Leslie. Thank you very much, Carmen, for the presentation. Very, very interesting, and congratulations on all the work in anticipating and data management that you're doing in Barcelona. I was just thinking that, wondering whether you also explore solutions for temporary water storage within the city. So when you have the heavy rains event, the water doesn't go directly to the sewage system, so you have more time to treat the water and then have all the water treated and avoid a bit the overflowing. I know in some city they do they use green areas, wetlands and things like that.
Yeah.
I wanted to know if it's something you're also taking into account, and maybe your model can also help in knowing when, where, if it's useful or not. Yeah, thank you.
Okay, Nadesh, thank you for your question. Well, in fact, this model, let's say that is the initial point is to have a CSO, so that the flow rate and the intensity of this CSO will depend on how this was managed before, right, by the institutions and so on. So with the possibility of forecasting all of these factors, let's say the conditions of the drainage, how this can buffer and absorb this intensity of rainfall, yeah, this tool can be used, but this is like the endpoint, the end line, okay? The endpoint of so this tool at this moment is the endpoint of this. And yeah, in Barcelona, they are now trying different strategies to also to upgrade the network, the system, and these nature-based solutions that you already mentioned. So they are working on that. But yeah, at this moment the model is not accounting all these things. So it's the end line of this. Yeah, thank you.
Yeah, thank you very much.
Thank you so much. And I also believe that to improve the model, you will need further coordination with other institutions and further data,
Yes.
resource allocation, and so on, so
Yeah.
on. Yes, yes.
Yeah, and also for being applicable to other sites, because now the domain is, it's this type of domain with the breakwater, and so it could be adapted. So it's like a proof of concept, let's say, but yeah, it needs a lot of future work. Yeah, yes.
Totally understandable. Thank you so much, Dimitris.
Yes. Thank you, Iglesias, for this presentation. It's more of a comment rather than a question. I think that it would be great for future work if these results were also coupled or extended to with assured surveillance systems results, also extending to other epidemiological parameters such as smoking, alcohol, drugs, which are not physically driven, such as the mechanism you described, but more socio-economically driven, also maybe due to extreme events. And thinking how much these systems have evolved after the COVID era, I think that there should be very interesting data and databases and tools that you could couple your results with. I think this would be very interesting.
Yeah. Data-driven modeling now is the next step. So coupled with this tool that is not the deterministic model but is more, let's say, mathematical behind that modeling, then could be improved, accounting with all this digitalization and real-time data collection, advances digital modeling, this artificial intelligence driven. So it's working with so in this way we can work with many other variables that can affect this exposure in many parts of the model. So exposure and the one that the factor that Nadesh mentioned that is more related to the release. No, but there are many things. Yeah. Thank you for your comment.
Thank you so much, Dimitris and Carmen. Maybe this would be an opportunity to further collaboration and continue the conversation. Yes. We will continue the presentations with Teresa Kaiser. Teresa, you can start sharing your screen. Teresa, she's an advisor on adaptation to climate change at the Delphi Research. She has done a lot of work on heat and health in recent years, particularly on heat action plans, and has focused on how stakeholders at different levels can work well together to strengthen our resilience to extreme weather events. Teresa, the floor is yours.
Thank you so much. Can you see the presentation?
Yes, we can.
Okay, perfect. Well, thank you for this nice introduction and also for inviting me here today. I'm happy to be here. And as you already said, I brought some examples from regions and cities in Germany, how they are tackling the health risks of extreme heat. And I will start with one regional example, the Heat Health Action Plan of the City and District of Würzburg, more with a focus on how they're organizing it, the policy approach, and then I will continue with some more examples of heat health prevention measures across German cities, more practical, concrete examples of measures to give you an idea of the range of different measures that are in place. And in the end, I have some thoughts on what and how we can learn from each other. So let's dive right in with the first example. You can see here the very beautiful city of Würzburg. It is located in the southern part of Germany, rather small city, I would say 130,000 inhabitants. And the district is rather rural with lots of very small towns and villages. And this region, as well as many others, faces an increasing number of heat days per year in the next decades, depending on which scenario you look at. So they decided it was time to prepare for that and do something. And unlike most cities, they decided to not only develop a heat health action plan for the city itself, but also include the whole region. So all those small towns and municipalities in the district that wouldn't have the capacities and resources to develop their own heat health action plan can now benefit from this initiative as well. And that's what makes this example special. And that's why I brought it today. So let's have a look what they actually did and how they set it up. So they formed a working group on heat health action. And members of this working group are the City of Würzburg, the Climate and Sustainability Unit, then members of the District of Würzburg, then the local health authorities of city and district, the Health Region Plus, it's what it's called, and then also other relevant actors from the health and social sector. So not only authorities, but also for example, insurance companies, the General Practitioners Association, urban planning architects, the university clinics. So all kinds of stakeholders that are involved in this heat health action planning are in one group here. And then they came up with a heat health action plan according to the WHO guidelines. I'm really happy that we're going to hear about that a bit more later, I guess. And I think most cities in Germany actually use those guidelines and formed their heat health action plans according to that. So you will find similar categories of measures and similar measures in most heat health action plans across German cities and regions. And this is also what Würzburg did. So with this working group, they have this coordination body and interdisciplinary cooperation and approach. They are using the official German Weather Service heat warning system. They have measures on information and communication, measures to reduce indoor heat exposure, to prepare the health and social care system. They have rather mid or long-term measures in the category urban planning, and they also consider monitoring and evaluation. And I would say it's quite a detailed action plan. So for each and every one of those 48 measures, they prepared a fact sheet. Unfortunately, it's in German. I linked you the plan here. Maybe, if you're interested, Google Translate or DeepL can help. But it's quite detailed. And for every measure, they have detailed information, what to do, who's the target group, who's in charge of implementing this measure, information on monitoring, best practice examples. So it's quite interesting to go through this catalog. I brought one example since we don't have so much time. So I already mentioned that they are using the official German Weather Service heat warning system. And in order to communicate if there's a heat warning in place, they make use of the electronic display boards at bus and tram stops and also of those electronic advertising boards throughout the city. And this is actually something that is also used in rural areas. So also there at bus stops, there is a sign if there's a heat warning in place. And it's not only the warning, but it's also connected with recommendations. So stay inside, avoid the sun, drink more, things like that. And yeah, with that, we're already leaving Würzburg. So we have some time that I show you some various and different measures across German cities. I brought some more examples. This one is from the city of Hanover. So we're moving up north a bit. And this measure aims at vulnerable population groups, in this case, homeless people who are considered very vulnerable to extreme heat events due to their exposure to heat and sun throughout the whole day. And also the use of alcohol and drugs can lead to an increased risk of a heat stroke. So we have a very vulnerable group here. And the city of Hanover had the idea of so-called first aid packages for homeless people. So during heat waves or during hot summer periods, city street workers distribute packages with water, sunscreen, hats, sandals, and also a list of the city's drinking water fountains to people in need. And they do that every summer to help homeless people cope with extreme heat and help them out here. My next example also is aiming at a vulnerable population group. In this case, it's older people who are also quite vulnerable to extreme heat. And this is an example of an information and communication measure from the city of Cologne. And those three charming guys you see in that picture are members of a local carnival band. Maybe if you're into carnival, you know them. I don't know. And they were asked by the city of Cologne when they developed their heat health action plan to write a song with important heat health tips. And then the band toured through retirement homes during summertime. And the aim was to encourage people to take precautionary measures during heat events, to drink more. The song is called Drink, water, I guess. And I think this is a very nice example of a communication measure besides all those flyers and brochures, which are, of course, also important, but this really helped raise awareness for the topic. That's why I brought it today as an example. My next example also is from the category information and communication, but a bit different. I guess you've seen maps like this before. I think lots of cities now have them in place. So this is an example from the city of Freiburg in the very southwestern part of Germany. And what they did, they created an interactive city map with where you can access or see where's the closest green space, for example, parks or forests, cemeteries. Where can I find a nice bench in the shade under a tree? Where are the next blue spaces, water playgrounds for children, then drinking fountains? And also they linked cool indoor spaces like churches or libraries. So spaces you can visit that are free and open to the public to escape the heat for a few hours. Then my next example is, from a different category, urban planning and construction. And it's not even part of an official heat health action plan, but was actually planned as part of a state garden show. It's from the city of Ellwangen. It's also in the southern part of Germany. And you can see on the picture here, like many other cities, they had this unused space under a large motorway bridge. And then they had the idea to use this space, which is also very, or quite cold during summer months due to this large shade area under the bridge, to build a skate park and football pitches, plant some more trees. So they have this quite nice park recreational area there now, and now it's a place where people can hang out, spend time even in the summer, even on hot days. And I think that's a very good example of how an area can be used multifunctionally. So it wasn't even intended as a measure in the context of heat prevention or heat health action planning, but has so many co-benefits in terms of, it's relevant for urban planning, creating public spaces, improving the cityscape. That's why I like this example, to show that there can also be measures with lots of co-benefits. These were just some examples. I tried to show a bit of a range here, but of course there are many, many more. Green roof strategies, blueprints for heat action plans for hospitals, measures to reduce indoor heat. And of course, we also look across borders. We want to see what other people, other cities are doing, what heat protection measures they are implementing. And I think exchange here is very important, to learn from each other, to see what works and what we can adapt. And I think it's particularly useful to look to the southern parts of Europe, since cities there have much more experience with extreme heat and also quite different approaches of urban planning. So I'm glad that we're going to hear from Athens later on. And what I really like in this context, maybe you've heard of it, it's the concept of climate twins. So twin climate cities are cities where you can assume that the future climate of one city will be similar to the current climate of another city. So it's kind of a window into the future. And there is one project in Germany, Project Plan C. It's a project for heat action planning in Düsseldorf and Karlsruhe, and they made use of that concept. So they identified the climate twin of Düsseldorf, which is Toulouse, a French city. And Toulouse now is a cooperation partner of this project and sharing its practical experience on heat action plans and heat prevention measures. And I think that's a very nice way to exchange ideas and see what other cities are doing, learn from them, and adopt some measures. And this brings me to my last slide already. So I showed you some examples of measures. There are, so many ideas, catalogs, toolboxes. You can go through all those heat health action plans. So there's no lack of ideas, but what is lacking is information on the effectiveness and impact of these measures. So I really want to point that out, because it's also a topic close to my heart, so that we really need to monitor and evaluate those measures so that we can learn which are the effective ones, which have a great impact. And we need to share this information so that we can all benefit from it, learn from each other, and hopefully have more resilient regions and cities in the future. And with that, I am closing already, and thank you for your attention.
Thank you so much for that insightful presentation, Teresa, for your reflection on at the European level. Indeed, we need more synergies. We need to disseminate information, replicate what it's working, and learn from each other. I do not see any question from the chat. If you would like to raise your hand, Nadesh.
Yes, thank you very much, me once again. Thank you very much, Teresa, for your presentation. Very, very interesting. Also to see the different kinds of solutions that we can implement to face heat in urban areas. I was wondering also, because when it comes to nature-based solutions or ecosystem-based solutions, sometimes the monitoring, the maintenance aspect is also challenging. So I don't know if you had some recommendations, experiences also on this aspect of the solutions that you presented. Thank you.
So what we learned is that it really helps to have everyone involved already in the planning. So what we learned is that oftentimes several departments, so there's one department who's responsible for planning and implementing something like a water playground or any kind of measure. But then it's another department that's responsible for keeping everything in shape and maintaining everything. And we learned that it's really important from the very beginning to have everyone at the table, and also to calculate those maintenance costs from the very beginning.
Thank you very much. I think in the chat we have one person asking for the links to the solutions, to the measures that you presented.
Yes,
because they're very, very inspiring.
Yeah,
particularly for the Wurzburg. If you could share the link for.
I will.
Thank you so
I
much.
will look it up.
And concerning Wurzburg, I'm sorry, I don't know German, so I'm not pronouncing it quite well. But I will have a question on the working group. How challenging it was to create this working group, and if you could share some advice, because as far as I understood, there's many stakeholders involved, and it's quite challenging to have all of these people in one table. So your advice on the strategies to, if there will be some interest on replication.
Unfortunately, I wasn't part of this working group, so I really can't share any insights on that. But I guess, yeah, we conducted several interviews with cities who tried to set something like this up, something similar. And I think it's always a problem to bring the climate and environment and the health people to one table, because in Germany it's quite divided, and also on the state level it's already two different ministries, and that's what we learned is one of the main problems here. But yeah, what always helps is when people know each other and go for lunch once in a while. That's like really basic, but this is, I think, what helps the most to bring things forward. Yeah.
That's true. Thank you so much, Teresa.
You're
we have
welcome.
A comment from Matja. If anyone has mapping of emergency health service response tool or other health data correlation with heat, please share. Just for the speakers, if you have this information. Thank you so much, Teresa. We will continue then with the next presentation of Dimitris. Dimitris, you can start sharing your screen. Dimitris Kofinas is a civil engineer and postdoctoral researcher specializing in hydraulics in the University of Thessaly. His research also encompasses climate change, adaptation and mitigation, as well as water, energy, food ecosystem nexus. He has extensive experience in interdisciplinary research programs, collaborating with a broad of international network of partners throughout the stages of research and the application of findings. Dimitris, the floor is yours.
Perfect. Thank you, Leslie. And I'm happy that my presentation hopefully addresses a little the question that is already in the chat. So I will be presenting the Arsinoe project case study 1, the Athens case study. And here is the Arsinoe methodological framework in a glimpse, just to give some background on what we're doing. We have 9 case studies. We apply our methodology in 9 regional case studies of 9 different target hazards and target risks related to climate change. Athens and heat waves is, of course, one. We are building living labs around each case study, and we are understanding, we're increasing knowledge in the systems related to the climate change target, to heat wave in this case, in 3 dimensions: in the physical dimension, in the socioeconomic dimension, and in the policy context. On all the different subsystems that are involved and interlinked around the target climate change parameter, the heat waves. And on these, after we increase understanding and we increase also understanding on the system vision with our stakeholders within our living labs, we co-create solutions, systemic solutions, so solutions that are not monothematic, solutions that have multiple benefits and answer to multiple hazards, to the hazard system, as we might say. Also, SINOI has some budget kept aside to channel to the actual implementation of the co-created solutions. So for Athens, of course, the challenge as it is identified in our living lab by our stakeholders is Athens is becoming increasingly hot with significant impacts on health, society, and the local economy. What is our vision for dealing together with this imminent and invisible threat? And so applying our methodology, RCNOI has an overarching methodological framework on resilience assessment. So we have a horizontal way on how to assess, to model, to simulate and quantify the risks and the impacts and the solutions. And this is a 5-tier level framework. So in the first tier, of course, we have the future society and socioeconomic scenarios. And here on the right, you see how this has been applied for Athens case study. Of course, tier 1 is horizontal for all the case studies. So for all the case studies, we have tested these two coupled future scenarios. And then on tier 2, we have the statistical downscaling of the target climatic parameters, so temperature, humidity, etc. for Athens. And then tier 3, we have the environmental and biophysical systems models. So what are the relevant systems for Athens, for heatwave, is of course the urban heat island, the biodiversity, the landscape fragmentation, the noise, the population density, the air quality, and the socioeconomic vulnerability are some of the layers of the biophysical layers that have been modeled or monitored or so quantified. And then the last two tiers, 4 and 5, are tiers that are related with responses, with solutions. So tier 4, we have the heatwave crisis response tool, which is for human and operational systems models. And we have a blue and green infrastructure tool assessment and assessment of willingness to pay relevant to the strategic response models. So in this presentation, I will focus on these two tools, the heatwave crisis response tool and the blue-green and blue and green infrastructure tool, mostly green infrastructure tool. And at the same time, these all 5 tiers are happening, being implemented around 4, let's say, operational spheres, the system or pillars, the systems innovation approach, which is our co-creation, let's say, pillar, the way we involve our living labs, the stakeholder decision making, the data and logic requirements for modeling, and the resilience assessment. What is our way of thinking resilience? We perceive resilience as a continuous risk mitigation exercise. So we have created mental maps from our living labs that are built around the risk equation, the very well-known risk equation, which is perceived as the overlap of the target hazard, the vulnerability, and the exposure. There is where we have to intervene and increase our capacity and increase our resilience through adaptation interventions. So what we have been trying to do is build hazard maps, vulnerability maps, expose maps, exposure maps for the Athens case study, multiply them, create risk maps in a very schematic way. I try to describe this, create risk maps, and there see which are our risk hotspots, and there intervene, there build our solutions. So here is the way our living lab, guided of course by all the scientific experts of RCNOI, our living lab has identified the hazards, the vulnerabilities, and the exposures. So we're talking about a system of hazards, and not only heat wave, but also air pollution, noise, biodiversity loss, violence are some of the hazards that have been identified as hazards that have synergies that operate together with heat waves and cause impacts. And of course, one might understand that biodiversity loss and violence are hazards on one hand, but are also cascading hazards caused also by the three first ones. And then we have the vulnerabilities identified, so morbidity and mortality, impact on well-being, tourism decrease, energy consumption increase, water consumption increase. And the exposures related to the vulnerabilities and the hazards, which is the animal and plant species, the residents, the workers, the businesses, the tourists. So this is our risk system. This is how we identify the hot risk spots, and this is where we intervene through two types of solutions. The more urban planning horizon solution. So here is a long-term horizon on how we increase our resilience through nature-based solutions, in essence, a green and blue infrastructure for the urban heat island mitigation, but also solutions that are more short-term and are relevant to the heat wave crisis. So here we identify the two horizons, the long-term and urban planning horizon, which answers to the question, how can we reduce the urban heat island? And we see that from the hazard system, we also we include a heat wave, air pollution, biodiversity loss, and noise. And here we're talking about impact on health, well-being, tourism, and economy. So the urban planning dimension has the long-term hazards, while the short-term and immediate response horizon, which answers to the question, how can we respond during the heatwave crisis, we involve here the heatwave and the air pollution hazards, and not biodiversity loss and noise, etc., because we need the more short-term hazards, the hazards that have short-term effects. And here we're talking about direct impact on human health and quality of life. For these two horizons, we have been developing two different supportive tools. So let's start with the urban planning horizon. We have developed a supportive tool that integrates and visualizes all risk parameters. So I will show in the next slide. It prioritizes adaptation for Athens neighborhoods based on long-term risk. So all these hazards and vulnerabilities and exposures have been visualized and assessed in sub-zip code level, so in neighborhood level. So we have created maps where we can see the combined risk at neighborhood level and design there our solutions or prioritize because we use prioritize the risk. And then assesses the relief that we achieve through a list of selected interventions or nature-based solution-based interventions. So here we see some of the layers, and at the same time, you see the results being published in the relevant articles. You can go and search for details. So here we have the hazards. We have the land surface temperature and the heat index as normalized hazard layers. Then we have the air quality. Also, everything is normalized between 0 and 1, so that we have the prioritized risk. Okay, we have the air quality index, and we have the biodiversity clusters. We have 4 types of clusters, meaning 4 different clusters of how much the environment is friendly as a habitat to urban biodiversity. Then we have the accessibility to green with the 5-minute walk rule or the 300 meters rule. We have the combined vulnerability, socioeconomic vulnerability as an index, composite index of the distribution in the city of elderly, retired, living in houses built before the 80s, living alone, renting, living in houses smaller than 60 square meters, unemployed, and immigrants for low-income countries. And also our exposure map, which is the population density. So here we see the combined risk map. We see the areas, the neighborhoods that are more red are the hot, let's say the hotspots, the risk hotspots. And this is where our experts have been applying and modeling 3 types of interventions which are tested: the cool roofs and cool streets, the green roofs and urban greening, and the green roofs and urban trees. So in this tool, you can see what is the relief that can be achieved through the application of these different rules, these different interventions, types of interventions. Here you cannot see numbers, but the deepest blue that can be achieved is a release of surface temperature approximately at most of 5 or 6 degrees, 5 point something degrees. And of course, a much smaller reduction in air temperature. And here we can see the architecture of our other tool, the supportive ABM tool for immediate response. This tool is an agent-based model tool that informs, supports the coordination, consults the involved actors on the high priority intervention spots and the type of support needed. So this tool is a tool to be used and coordinate all listed resources, following and integrating 4 categories tier on a heat wave based on temperature. It is a categorization of heat waves used by the municipality of Athens already, and it is introduced by the Rockefeller Arts Institute, to my knowledge. And so different categories of heat wave mobilize different kinds of resources. And here we can see the kinds of resources that we have listed. So we have guidance, so information. So it is a website, alert messages in digital labels, as the previous presentation also referred to, SMSs, all different kinds of guidance. Then we have shading and cooling. So for shading, we have the green areas, the parks and the municipal parks and the regional parks. And here I have to say that there is also a small conflict with the hazard of wildfires, because access in some of these parks and the regional parks is prohibited during the wildfire hazard. So we see that here there is some, these two hazards need to be differentiated and assess the resources accordingly. Cooling, so we have listed all the cooling places, the AC, the air-conditioned places in the area. We have integrated knowledge from existing tools like the Extrema Global, which has been very useful for us. We have exploited all different kinds of databases for Athens. The drinking water, so distribution of bottled water, the animal support, and then the first aid and the medical care resources. And we have listed all these kinds of resources which fall under these categories, also according to the owner of the resource, so who is responsible for mobilizing these resources. So the extreme heat wave crisis risk map creates the requirement for the allocation of these resources, which are assigned according to these four categories. This tool is still under development and hopefully in the next months will be available. The previous tool is already ready. And referring to the urban planning tool, now, the more long-term tool, we have two pilots. As I told you, Arsenoi has kept funding for specific interventions, actual interventions. So two of our three interventions, because there is also a third one, two of our interventions is the singular ribbon and the tiny forest in Athens. So we are talking about green infrastructure here. Two pilots in that are going to be are already actually developed in the hotspot areas of Athens, a specific spot that has a very increased risk of heat waves. The singular ribbon is a lightweight linear structure of challenge for a continuous strip of vegetation through hydroponics. And it decreases temperature through shade and evapotranspiration and has a positive impact on biodiversity. And then the tiny forest in Athens, fast-growing native woodland, typically made of 600 trees, planted in a tennis court-sized plot of 200 square meters. It connects people with nature, it mitigates the impact of heat stress, and enhances urban biodiversity. One thing that I haven't referred to, and you can, however, understand, is that in the Living Lab and in our solutions, we have perceived health as the One Health concept. So as the integrated concept of taking into account a human, animal, and environment health. And this is why we have also integrated even from the guidance of our Living Lab, biodiversity in it and animal protection as well. And here is the team that has worked on these tools. Of course, there are many more experts behind the implementation of the model and the systems innovation approach, methodology, etc. I hope everything was clear. So please,
thank you so much, Dimitris, for this presentation showing the experience of the RCNOE project.
Thank you.
I don't know if there's a question for the speaker.
I think it's just participants
yes.
exchanging on best practices and tools.
Yes, yes,
Yeah.
I see. I think so. Just a quick question, Dimitris, to give the floor to our last speaker. On the heat mapping, I'm curious about the satellite imagery that you use. Could you please let us know which is the one that you use, if it's Landsat, Sentinel model, and MODIS, and also the spatial resolution, just in case of there's interest on replicating this.
Yes. So the source for this is a Landsat several missions with a spatial resolution of 100 meters. I'm seeing them by notes.
Okay. Yes, I think it will be needed because
yes,
to talk about neighboring scale.
Yes.
Very
so
precise.
the specific presented map is a mean distribution of summer land surface temperature in Celsius for the months June, July, and August from the years 18 to 23.
Okay. Okay. Thank you so much, Dimitris.
Thank
We're
you.
a bit restrained for the time, so I will pass the floor to our last speaker, Marisol Iglesias Gonzalez. Marisol, you can start sharing your screen. She's a technical officer for climate change adaptation and health at the European Center for Environmental and Health from WHO. She's currently co-leading the development of the second edition of the WHO guidance on heat health action plans, working closely with scientists and public health experts to deliver updated and actionable recommendations for policymakers and health authorities. Marisol, the floor is yours.
Thank you, Leslie. I have a quick question for you. Do you still want me to do a brief recap or insights considering that we're running out of time, or should I just jump straight in?
Just jump straight in, please.
Okay, wonderful. So thank you so much. Good morning, good afternoon to everyone. And today I would like to provide you an overview on the work that WHO Regional Office for Europe has been doing on the topic of heat and health, and also to provide some general context and landscape on what the situation is globally, but also regionally speaking. So as we have heard today, we know by now that heat is no longer a future threat. This is a major public health challenge. And here we can see on the latest Lancet Countdown report, we can see how heat-related mortality among vulnerable populations, and specifically those who are 60 years old and older, broke the record on heat-related mortality by 167% compared to its baseline. And this is an alarming trend that we're seeing globally, but also regionally. And this calls out not to only take urgent mitigation actions to meet, for instance, the Paris Agreement and limit future warming, but also it underscores the urgent need for stronger adaptation measures to protect everyone, of course, but especially the most vulnerable populations. How we address climate change today will shape the lives of future generations, including those being born as we speak. Imagine a child that was born back in 2020, and that child took their first breath in a world 1.1 degrees warmer than what was once considered normal. They have learned to walk on streets that are already hotter. They are living summers filled with record-breaking temperatures. And by the time they turn 70 in 2090, even in the best case scenario, they will live in a world that is warmer than anything you and I have ever known. As cities grow, so does the heat, as we have learned in the presentations today. And the IPCC warns with high confidence that heat-related deaths and illnesses will rise. And of course, as we know, the risk will not be distributed or felt equally across different countries. Some regions will be hit harder than others, and urban areas where heat lingers in streets, buildings, and homes will become even more dangerous. Europe is already at the forefront of this crisis. It is warming twice as fast as the global average, and by the end of the century, temperatures could rise somewhere between 2.5 degrees to up to 7 degrees. And I would just like to highlight that These are all numbers and statistics, etc. But behind each of these data points, there is suffering, there's people, there are communities, and of course, there is a greater pressure on hospitals and emergency services. In the case of our WHO European region, we have seen that the four warmest years have all occurred since 2020. I think we are all starting to get some overwhelm already of hearing every year how we're broken the annual record of temperatures. And also, and the trend is, this is the trend now. As the Secretary General of UN said, heat is the new abnormal, no? And also in 2023, we saw a record number of days with extreme heat stress. And we can basically conclude that heat waves are no longer rare events. 19 of the 23 most severe heat waves since 1950 have happened in just the last 2 decades, with 4 in the past 3 years alone. And we know that the consequences are devastating. People days of heat wave exposure have nearly doubled in the last decade, and heat-related deaths have surged, reaching an average of 17.2 per 100,000 people. And in 2022 and 2023 altogether, Europeans have lost their lives up to 100,000 deaths in these 2 years. So in the WHO European region, we have been working for several years now on climate change and health, but I just want to point out that back in 2023, and this year was a turning point for the WHO Regional Office for Europe, because for the first time in history, WHO declared climate change a public health emergency, a landmark that was announced by Dr. Hans Kluge, our regional director. And this milestone aligns with the 7th Ministerial Conference on Environment and Health, where climate change was established as a core pillar of commitment among member states. And at this ministerial conference, countries of the WHO European region adopted the Budapest Declaration, which prioritizes urgent, wide-ranging actions on several health challenges, including climate change, environmental pollution, biodiversity loss, and land degradation. And this was the first time that member states were highlighting the risk that climate change is posing on public health. In the Budapest Declaration, countries adopted 7 key commitments around climate change and health, as we can see on screen, which reinforces their dedication, their interest, and also their concern on the topic. And among these commitments is the development and the updating of heat health action plans, ensuring that member states are better prepared to prevent and to respond to heat. As it was mentioned earlier, there is a guidance from WHO on heat health action plans, and I just want to briefly walk you through the process that has been happening in the region since 2008, which was the year where the first guidance was launched. And this guidance is one of the most downloaded products of WHO, so it's quite a, I would think, a successful product that has helped and assisted many countries, not only on the European region, but also globally. And this document basically provides 8 so-called core elements or components that should be part of heat health action plans based on WHO's recommendations, and also expert and evidence, backed up by evidence and expert support. This has also communications materials embedded, but in 2011, there was an update on public health advice with the issuance of, I think, over 14 information sheets addressing different aspects of heat and health across different stakeholders. Later on in 2018, there was an expert meeting to discuss on evidence on heat, to discuss potential areas where updated evidence was needed and ways in which the updated evidence could be packaged. This led to the development of a publication on heat and health in the WHO European region, launched in 2021, which pointed towards the clear need of updating WHO's guidance on heat health action plans, which under the funding from the European Commission, we are currently developing. So this new heat health action plan and the second edition after almost 16, 17 years of the original one, will also be composed by 8 core elements that have been updated, and some of them have been renamed, covering aspects of governance, of course, warning systems, vulnerable populations, health systems resilience, monitoring, evaluation, and learning, among others. In 2022, experts that were involved in this heat health action plan process also conducted an analysis of heat health action plans across the region, revealing that 19 countries had developed such plans, so 19 out of 53. And heat health action plans, as I mentioned, consist of these 8 core elements, which you can see in this table listed on the first column. And one of the questions that was made in a survey that was shared was the level of implementation of each of these core elements. And as we can see, the early warning system aspect was the most widely implemented core element. However, those core elements requiring more long-term commitment and sustained follow-up remain the least implemented. Those are preparedness of health and social systems, long-term urban planning, and real-time surveillance and monitoring and evaluation. And I was asked to present an example of heat health action plans in the region. I came with 3, but because of time constraint, I'll just focus on one of them, and it's the case of France. But I would like to highlight that there are several countries that have done amazing progress, as we have heard today from Germany's subnational heat health action plans, and also there's a lot of good experience and learning from Italy and from Austria, among other member states. So just to focus on the experience of France, and this was mentioned, I think, on the first presentation, but just to recap that in August of 2003, it was the heat wave that changed everything. In just 2 weeks, that heat wave took 15,000 lives in France in just 2 weeks. And the country at that time was unprepared. There was no coordinated response, no clear warnings, and the lack of information sharing left the most vulnerable exposed. And the spike in mortality in August 2003, which is visible in this graph, is stark reminder on how deadly heat can be and why early warning systems, why heat health action plans and adaptation measures and coordinated action can save lives. And this strategy became a wake-up call. And in 2004, France introduced its first national heat prevention plan and warning system. I think this is the oldest plan in the region. And 20 years later, so by 2024, the plan had grown into a fully governmental strategy engaging 10 ministries. So for the first time, meteorologists and public health officials worked together to anticipate, alert, and protect communities. And as you can see on screen, other ministries were also involved, from health, security, education, labor, which I consider it's a major success, but I want to highlight that this took 20 years to happen. So I think Teresa was mentioning how important it is to, go to lunch and have this maybe informal relationship, but this is very important to have like-minded individuals, if possible, and build trusting relationships to enhance this process in order to promote these collaborations and be able to involve all this variety of stakeholders. Also, in terms of the health warning system and health data, so France heat health warning system is built on a cycle of data-driven decision-making using the before, during, and after approach to heat events in order to minimize the health risks. So for instance, before a heat wave, there is a development of epidemiological studies which are used to define evidence-based thresholds for issuing the alerts using temperature forecast, ensuring that the warnings are as much as possible scientifically grounded. During a heat wave, there is a near real-time health surveillance that tracks emergency visits for heat-related illnesses. And I say near real-time because there is just a one-day delay. But of course, there are more challenges when it comes to gathering mortality data, which can take a bit longer to emerge and be accessible. And after the heat season, very importantly, is the annual impact assessment to analyze mortality, morbidity, risk factors, and intervention effectiveness to refine future response strategies. And even though this sounds like a logical step to take, I think this might be also a bit overlooked. We are taking these implementation measures, but then we're not properly assessing the benefit and also not properly assessing the lessons learned and how we can improve for the next year. Some lessons learned that have been shared by France when it comes to their warning systems is that, of course, after 2 decades of implementation, they have gathered a lot of valuable insights, and they of course share what works, but also challenges remain. One of the key learnings is that a warning system must be robust, must be adaptable, and must be able to function even under extreme conditions. So when temperatures reach up to 50 degrees and systems are under stress, the response must still hold. Early warning systems based on temperature forecasts are effective, and delay actions can be costly. Waiting for health impacts to appear is too late. Collaboration, as mentioned, is essential during heat waves, and one of the good practices that they have cultivated during all these 20 years is to keep daily meetings when these events happen between Meteo France and the Ministry of Health to help guiding decisions. And another essential aspect that sometimes also I consider might be overlooked is communication. Communication is very important before the event, during the event, after the event, or after the summer season. This in order to maintain the public awareness, to ensure preparedness, because there are still some challenges. For instance, that the risk perception of heat as a health threat, it remains low. And there is also the reality that people get some warning fatigue of hearing all these alerts. So it's important to keep engaged the public and also be able to communicate in a way that eases on that fatigue. I would just like to close with these words from one of the scientists from Public Health France, the very well-known Mathilde Pascal. She said, 2003 is like something that comes from the future and says, you must get ready because I'm going to come back. So if 2003 was a glimpse of the future, then we must take it, we must take the message seriously. And because of how frequent and severe the heat waves are becoming, we know that the message is serious. Extreme heat, the extreme heat experience that year in 2003 exposed the weaknesses of preparedness, communication, infrastructure, healthcare, public awareness. And adaptation means preparing cities, homes, and people for higher temperatures. So the question here is not if the heat wave will return, because we know they are, but it's whether we'll be ready when they do. Thank you so much. And I'm not sure if we still have time for questions. If there is a question, I'm happy to take it. If not, my email is on screen, so feel free to reach out if you have any questions. So I'll stop now and over to you, Leslie.
Thank you so much, Marisol, unfortunately, we don't have time for questions, but as I said, all the presentations will be shared with all the participants. Thank you so much for your reflections, and indeed, the communication is key, good governance is key, resource allocation, and data in building resilience.